consistent systems, four systems, where you don't have an active unit, but you have two active units. It means that you don't have any anchorage unit. You move two teeth one against the other. So a very simple thing regarding absolute consistency is when you have two teeth like this and have a diastema maybe, and you apply two forces, one against the other. I apply them here at CR just to avoid the tipping. And so you don't have a reactive unit and an active unit. So the two teeth are going one against the other. So what happens when you have two active units? So the first thing you have to understand is that sometimes it's not easy to pick up conditions where we have absolutely consistent systems. And I give you an example of this case. So probably if you are beginners with the use of the systems, it won't be easy for you to see these opportunities, but they are often there, and you have to probably to get trained to see this very fortunate conditions. So give a look here. We have a cant of these teeth. So we want to correct this teeth. You see that the bite is deeper here and it's more open here. So usually what I would do, and most of the time, I would have a cantilever coming from this side, which is very simple, some millimeters away from the midline. So I would produce an intrusion and a moment in this case. Or if you have an open bite case, not in this case, but in another example, I could do something completely different. That is to come with an extrusive cantilever from here and apply the force in this area. So in these two cases, it's very understandable that if I have to apply the force to the right, I'm coming from the right molar. If I have to apply the force to the left, I'm coming from the left molar. This is seems to be very smart. But in this case, as you can see, this was treated in our department in the university by a student of mine. I had suggested to my student to apply the force here, and you see that the bite is getting, the occlusal plane here is getting more straight, and the cant is almost totally corrected. But why am I using a cantilever coming from this side? I'm using a cantilever coming from this side because there is an opportunity here to have the correction of both the molar position and the anterior position. So let's try to understand. I want you to look very carefully because the tip of the buccal cusp of this molar is here. It means that the molar is like that. Okay? So if I apply this cantilever that you see here, I don't like this configuration. This student made a mistake just by bending a V here. Rather, it should have done a different bending. We will discuss it later. But anyway, if we apply this cantilever, what we are doing, we are applying this force to the anterior teeth, but also this force here to the molar. And this means that the molar is having an extrusive force, but a very large moment, which is equal to the force times this distance. So what are you expecting by this? I'm expecting that this molar tipping will get corrected, and you know, it was almost in crossbite, and this should be fixed. This is fixed, and you see that at the end of the treatment, this molar is definitely out. But this was not the only reason, because we have to think in 3 dimensions. And let's see what was the position of the molar This is what I had just explained. So this activation as seen in the front plane, and you see the big moment which is created here. But let's see what is going to happen on if we see the teeth from a lateral view, from a sagittal view. Here you see that this molar is definitely mesially tipped. So if I apply vertical force here, is the same force you were seeing from the frontal plane. What is going to happen here? We will have this force and the moment, which is fine because it's going to fix our mesial inclination of the molar. Of course, we wouldn't be very happy to reopen this space probably. In fact, we have a metal ligature here, and here you see what happened. So this is something which is giving, it's not easy for you to, if someone is a beginner, just to see these things and use cantilevers and statically determined mechanics in this way. But it gives to you an idea, and a very important message. If you are aware of the force system you are producing, then you can be in full control. That's for sure. You cannot be in full control if you have no idea of the force system that it's generating. So the more you know about the force system, the more control you have. And by the way, this is the topic of the presentation I will do in Paris for HOIS. And so if any of you is coming to Paris, it will be an amazing meeting, and there will be other 3 others great speakers besides me. But what I'm going to discuss it is why we do mistakes in orthodontics, and many of the mistakes are just done because we don't know exactly the force system that we generate. But this is not happening if you're using statically determined mechanics. So one